everyone. I am a volunteer with For a Safer Space. Today's presentation is about eating disorders. I would like to begin this presentation with a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as Toronto Metropolitan University. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in a spirit of peace, friendship, and respect. Today's agenda will include a brief introduction about eating disorders, followed by more information about eating disorders, types of eating disorders, risk factors, complications, recommendations, and lastly, the conclusion. Eating disorders are serious mental health conditions linked to compulsive eating patterns that have a negative impact on a person's mental and physical well-being, as well as their ability to carry out daily tasks. This illness is treatable and can affect people of all ages, races, and genders. Many eating disorders develop in adolescents and young adults. There are some helpful options for dealing with eating disorders. There are various types of eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, rumination disorder, and avoidant restrictive food intake disorder. Eating disorders are characterized by behaviors such as restrictive eating or avoidance of certain foods, binge eating, purging through vomiting, or laxative misuse, or compulsive exercise. At any given time, several million people suffer from eating disorders, the majority of whom are women between the ages of 12 and 35. There are 5 types of eating disorders that I will be discussing about, which are anorexia nervosa, bulimia nervosa, binge eating disorder, rumination disorder, and avoidant restrictive food intake disorder. Anorexia nervosa is a potentially life-threatening eating disorder characterized by a restriction of food relative to the weight of the body, intense fear of gaining weight or becoming obese, and distorted perception of weight or shape of the body. Anorexics go to extreme measures to limit calories or lose weight, such as excessive exercise, the use of laxatives or diet supplements, or vomiting after eating. This can cause severe health problems, sometimes leading to fatal self-starvation. Bulimia nervosa is a serious, potentially fatal eating disorder characterized by binging and purging, which involves a sense of loss of control over one's eating. Many bulimics don't eat during the day, which leads to more binge eating and purging. They typically consume more food in a shorter period of time than most people would consume in a longer period of time, and then try to burn off the calories in an unhealthy manner. Bulimics are concerned about their weight and body image, and they harshly criticize their perceived flaws. Binge eating disorder is the most prevalent diagnosis among all others. It occurs when a person consumes excessive amounts of food on a regular basis and lacks control over the eating habits. Even when they are not hungry, they continue to consume food until they are uncomfortably full. After binge eating, one may feel guilty, ashamed, or disgusted, but they do not try to make up for it by exercising excessively or purging. Avoidant restrictive food intake disorder is characterized by not meeting one's minimum daily nutrition requirements due to a lack of interest in eating. A person with this disorder avoids foods that have certain sensory properties, such as color, texture, smell, or taste. Or they may be cautious of the consequences of eating, such as choking. This can lead to significant weight loss or failure to gain weight in childhood, as well as nutritional deficiencies. Certain factors can make a person more prone to developing an eating disorder. These include family history. So people who have parents or siblings who've had an eating disorder are more likely to develop an eating disorder. Dieting and starvation. Many symptoms of an eating disorder are due to dieting and starvation. Other mental health disorders. People who have an eating disorder often have a history of anxiety, depression, obsessive compulsive disorder. And lastly, stress. Major life changes in a person's life, such as going to post-secondary school, moving, family issues can bring stress, which can increase the risk of an eating disorder. Eating disorders cause a wide variety of complications, some of them being life-threatening. The more severe or long-lasting the eating disorder, the more likely a person will face severe complications, such as serious health problems, depression and anxiety, suicidal thoughts or behavior, problems with growth and development, social and relationship problems, substance use disorders, work and social issues, and death. Treatment is often provided through primary care providers, mental health professionals, recovery support groups, and dietitians that have experience in eating disorders. Treatment will usually involve talk therapy as well as regular health checks with a physician. Treatments are tailored to the individual and may include a combination of treatment options, but it usually includes 3 components. Firstly, individual, group, or family psychotherapy. Cognitive behavior therapy helps reduce or eliminate unhealthy behaviors such as binge eating, purging, and so on. Cognitive behavior therapy involves learning how to recognize and change distorted or unhelpful thought patterns. Secondly, medications. Medications. A doctor may prescribe medications such as antidepressants, antipsychotics, or mood stabilizers to help treat an eating disorder or other conditions that may be present simultaneously, such as depression or anxiety. And thirdly, nutritional counseling. This involves working with a dietitian to learn proper nutrition and eating habits. If a person has undergone a drastic weight change, the dietitian will aid in restoring or managing a person's weight. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible, inclusive mental health care. Visit the website for more information if you'd like to reach out for support. That concludes the presentation on eating disorders. Thank you for watching.